Hi, it's Tara Scott from Revitalize.
Hi, I'm Dr. Laurianne Scott from Women's Comprehensive Health Center.
So we were talking today about myths of hormones, and you still do quite a bit of PAPs and traditional regular GYN.
Traditional GYN, PAPs, annuals,
Operating.
well woman, operating GYN surgery.
And 2 years ago, I quit and focused completely on functional medicine. So it got to talking because you're still seeing people for their normal checkups when they're not really having complaints, or maybe they're having some complaints in menopause. What do you think are the myths that you hear that people still think about hormone therapy?
Yeah, so traditional things that I hear about hormone therapy is that it causes breast cancer.
Oh, that is a big one. And so that's really frustrating because I actually see people who, if you don't know your own hormone levels, they're at higher risk for breast cancer because they're producing so much estrogen that's unbalanced from progesterone, not because they took hormones, but because they maybe didn't think about taking progesterone to balance it. So the studies have been pretty clear that the synthetic progestin is the one that has the increased risk of breast cancer, and that's not something that we prescribe for hormone therapy.
Not.
But the normal bioidentical progesterone does not. And coupled with bioidentical estrogen, it hasn't been shown to increase the risk of breast cancer. And that was one of the trials that was done in Europe in 2008. So that's a big one that I think people still think about. What else?
So the next one would be weight gain, that hormones cause weight gain.
That is so true too. So people think because they gain weight at the time of menopause that if they take hormones they're going to gain weight. But I also see the opposite, because estrogen is kind of like Goldilocks. So too much is not good, too little is not good. And the decrease in estrogen also triggers weight gain as well. And they studied this in mice. When they removed their ovaries, they gained weight. And so they just restricted their chow because they thought maybe they were eating too much, and they still gained weight. They just didn't have any energy to move. So the amount of estrogen is important for weight gain as well. And so some of the things that used to be used, like synthetic estrogen and synthetic progestins, common ingredients that are also in oral contraceptives, people gain weight on that. That's what has been traditionally used, still to this day sometimes, I think, for hormone therapy, and that seems to gain weight. But when you use the right amount of hormone levels and you're monitoring them, our patients don't really gain weight. So that's one thing that is another myth.
Absolutely.
What else do you
Super
hear?
important to monitor levels.
Absolutely.
The other thing that I commonly hear would be that it increases the risk of heart disease.
Yeah, that's really frustrating too. It's actually there's pretty well studied that estrogen, especially if you take it through the skin, does not increase the risk of blood clots and does not increase the risk of heart disease. Heart disease is the #1 killer in women, and that risk goes up at the time of menopause. And there was a small study that they did that women were on a treadmill and they started to have EKG changes. So they gave them something called tetrahydrobiopterin, which actually is like nitropase that opens up the coronary blood vessels, and they saw a resolution of EKG findings. In the same population, they put an estrogen patch on them, and it was equally effective at correcting the EKG changes from heart disease. So the studies are pretty commonly popular that protective, that estrogen does protect your heart.
Yeah, and we know too that estrogen plays a role in every cell in our body. You know, our brain, it's really important for our muscle function, and just so much as women. And as we age, we want to, it's super vital that we stay healthy and strong, and our bones stay healthy. We know it definitely plays a big role in bone health.
So do you feel like everyone should take estrogen?
Absolutely. I mean, however, it needs to be done by a prescriber that knows how to prescribe hormones correctly and safely. One thing I would strongly recommend is also having your hormone levels tested before, during therapy, to make sure that you're not getting excess and that your levels are right.
And I think that's part of the problem that we went wrong. I say we, but I mean gynecologists, is that there were no pre-treatment levels, there were no post-treatment levels. There's so many different ways to monitor hormones. They weren't monitoring the correct way, and so you just need to make sure that you are advised of the risk and the benefits, because the studies are are agreeing that it's not the hormone, it's the dose, the duration, the type, the form, how you get it, how long you take it. So it's not that something that's natural in your body is bad for you, it's in the wrong patient without a proper risk assessment. So make sure that if you're somebody who's interested in hormone therapy, and if you've been believing any of those myths, that you work with a provider who is well educated about the differences. Hope you're having a great day.